Welcome to Aesthetic TV. We're here in the Aesthetic Lounge where we have a very special segment for our Aesthetic TV viewers on a brand new product called Allure from Syneron.
That's right. You know, more and more these days, we're hearing that skin discoloration or dark spots on the skin are the new wrinkles. This amazing new product called Allure effectively solves these issues quickly, safely, and comfortably.
And with us today to talk about Allure is the director of the Vitiligo and Pigmentation Institute of Southern California, dermatologist Dr. Pearl Grimes. Dr. Grimes, thank you so much for joining us today to take the time to be with us.
Dr. Orden and Brenda, I'm delighted to be here with you today.
You know, Dr. Grimes is here to show us a wonderful new natural product from Syneron called Allure that addresses skin discoloration and dark spots.
Yes, Allure is truly an exciting new addition to our agents that improve dark spots on the skin. And unlike some of the older agents that we've used that block the enzyme involved in making pigment in the skin, this exciting new agent works by a totally new mechanism. It dissolves the melanin in the skin.
Yeah, because up till now, really, we've been limited to hydroquinone, and as we know, does have some side effects and doesn't work for everybody.
The interesting thing about hydroquinone, it's been around for 50 years, and as dermatologists, we have been looking for a new grail for a long time. And so it's exciting in that we now have a new non-hydroquinone product working by a novel new mechanism, and results suggest that it really works and it has an excellent safety profile.
Well, I must say, those are some big words. So why don't you explain to us a little bit about skin discoloration or dark spots?
Pigment problems are common causes of visits to a dermatologist, and of these conditions, most of the visits are for dark spots.
Okay.
And common causes of dark spots are, number one, chronic sun exposure, sun damage. We see dark spots from inflammation in the skin. Common causes are acne, allergic reactions, and another common cause is a condition called melasma. And melasma is this chronic condition that results from probably a hereditary predisposition combined with hormones and chronic sun exposure.
And as we know, can be very tough to treat.
Absolutely.
Yes.
Melasma, of the three conditions that I've just described, I think melasma probably is the most difficult condition to treat. And while we can't cure it, I think we can do an excellent job of treating it.
Which brings us back to this wonderful new product called Allure. So Dr. Grimes, can you just share with us how this product works exactly?
Yes. We've had an excellent experience using Allure in my practice. Unlike hydroquinone, as Dr. Orden already discussed, the common drugs that we use, such as hydroquinone, work by blocking the enzyme tyrosinase that is involved in pigment production.
Are you with us here, Brenda?
Oh, wow, those are all really big words. I've got two very smart people on either side of me, but I'm getting it. I am. This makes sense.
To make it simple, it blocks systems to make pigment. Unlike hydroquinone and other common agents, Allure breaks down pigment in the skin.
I get that.
And
that makes sense.
This is the exciting thing is this is a natural agent.
Right.
It breaks down melanin and is the first of its kind. We don't have any other drug that works this way. And the other interesting thing is you can see a clinical response in 14 to 28 days.
Oh, that's wonderful.
Patients
wow, this is
perceive
exciting.
that their skin is getting lighter.
Well, I love the fact that it's natural and it works with your skin rather than against your skin. It's actually working, with your skin.
And in my practice, we've used it for melasma. We've used it in patients who have chronic sun damage,
Right.
and in post-inflammation dark spots, and we've seen great responses in all three conditions.
Okay, so let's get down to it. We've got some of these products right here in front of us, some of these amazing products on the aesthetic table here. First, we have the Advanced Skin Lightening Lotion. We have the Foaming Face Wash, and we have the Advanced Lightening Night Cream. So these products are all best and most effective when they're used together. So maybe you can explain to us, Dr. Grimes, how they're used and how we use them on our face.
I think these Allure products work best, as you stated, when they're used together.
Right.
Let's talk about the cleanser first.
Okay, so you start with the cleanser.
Yeah,
This is what you do.
yes.
You wash your face.
You wash your face
And then you start with the cleanser.
this foamy hydrating cleanser.
Okay.
Excellent product. So you're removing surface debris.
Okay.
So you're setting the stage for absorption.
Ooh, I like that
of your
stage. We love
topical
stages.
You getting it?
bleaching
I'm getting
agent.
it. Yes.
Yeah,
Okay.
so once
Got
you
it.
wash your face, a couple of minutes later, you
Right.
apply this morning agent. And this is a lighter product. And
Mm-hmm.
what we find is that many patients don't want to use a heavy moisturizer in the morning or a
Right.
heavy moisturizing base. So this is a lighter formula containing the active Allure ingredient,
Right.
melanozyme. And the nighttime product here, same ingredients, Brenda, but in a heavier formulation, a
Okay.
much more moisturizing
Right.
formulation, which we find most patients prefer at night.
Okay.
So lighter formula in the morning,
Got it.
heavier, more moisturizing formulation
Beautiful.
at night.
Well, it makes
Okay,
sense.
it
While you're
does.
sleeping, that's when you have to work on that skin and get it nice and healthy.
Yeah, have it looking good. And then we have the Advanced Face Wash. So it sounds like it's all together, and we have a really comprehensive product here.
You know, and Dr. Grimes was nice enough to bring some of the photos of the results that you can expect to see with Allure. And as we see in the photos, results are tremendous with Allure's novel technology. And patients can actually see improvement as early as 2 to 4 weeks after starting the treatment.
And I think, Dr. Orden, as you've said, these photographs really demonstrate that. Here you see a patient who has some diffuse darkening all over her
Yeah, I
face
see
at
that.
baseline, and then we have the photos at 28 days, marked improvement, overall lightening of her skin with 4 weeks of Allure use.
That's
Yeah,
incredible.
that's
I
a
think
pretty-
these photos are very impressive.
They are very impressive.
And in fact, you have more photos that you brought to share with us, and those will be up on the website that you'll be able to take a look at. But I think it's important to understand you will see that response in 2 to 4 weeks,
Yes,
but you
yes.
do have to stick with your
Right.
regimen.
Excellent point. While I think that the message here is one of the unique things of this drug is the early response, but you do have to stay on the regimen for a longer period.
Right. Well, thank you for that. Which brings us to our guest, Tracy. I'd like to invite her on. Come on, Tracy. Now, she's had some problems with skin pigmentation and spots, and she wanted to talk to you about those things.
Hi there, Tracy.
Hi.
Welcome.
Tracy.
You know how lucky you are to have Dr. Grimes here
I
doing
know.
a
Yeah,
little
it's a free consultation,
consultation.
right?
Right here,
for you.
right now.
So Tracy, tell me a little bit about your skin issues.
Well, I haven't always used sunscreen.
Tracy.
I know. And I'm realizing as I get older, I'm seeing more dark skin spots popping up all over my face.
Okay, so let's take a look. So Tracy, what I'm seeing, I see a few dark areas on your forehead, few spots on your cheeks, and I think what you may be experiencing are some early signs of the dark spots related to sun damage. I think that Allure would be an excellent choice for you.
Okay.
I think you'll see improvement quickly. Hopefully by 28
Great.
days, so definitely would recommend it, and use your sunscreens as well.
Okay.
You know, Dr. Grimes, let me ask you a quick question. So is Allure for, various types of levels of pigmentation or sun damage, or could it be used on extreme, or is it more just on maybe a lighter case such as Tracy's?
The interesting thing about Allure, as I mentioned earlier, it breaks down melanin pigment in the upper layers of the skin.
Right.
If you look at the conditions that we talked about, there's an increase in melanin in all of these conditions, so Allure is appropriate to use for sun damage, dark spots from inflammation, as well as that chronic condition called melasma.
That's
All
amazing.
three, we see that increase in melanin, and Allure works to break down that pigment.
So I think what Dr. Grimes is saying, if you have a lot of melanin as a result
Right.
of some of these processes, then Allure is just going to be doing a little bit more of
Right.
what it does in breaking down those pigments.
Well, yeah, because like I noticed myself, excuse me for interrupting, that, you know, I didn't have these issues and, you know, I use sunscreen. But when I got pregnant, I had my children, and then I would go out in the sun for various reasons because my hormones, which is what you had mentioned earlier, I did see spots, and I was just like, where are these coming from? And a product like this would be perfect for women like myself who, you know, it's not just the sun damage, it's, you know, a hormonal thing as well.
I think there's one other fascinating point to make in using Allure. It can be used in combination with other anti-aging products,
Oh,
such
that's
as
good to know.
retinoids. And
That's
we've
great to know.
used this
Right.
combination approach in my practice, and we've achieved excellent results.
See, that's great to know because that was another question I was going to ask you. Can you use this in conjunction with other products, or, you know, will your face explode because there's too many
No.
things on your
You
skin?
certainly can.
So that's good to
be
know.
Very effective in using it in combination with other anti-aging products.
Fabulous.
Yeah, and this way you're dealing with the biggest issues, those wrinkles and those brown spots,
Yes.
and maybe putting a little more volume back into the face. So
right.
that's a very important point.
Thank you so
Great.
much.
Dr. Grimes, thank you so much for stopping
Yes,
by and
thank you.
sharing your insights with us. Really great stuff. You know, I'd like to remind our viewers again that for a limited time, you'll be able to take advantage of our special offer exclusive only to Aesthetic TV viewers. I'm Dr. Andrew Orden, and thanks for watching Aesthetic TV, the ultimate destination for looking and feeling your best.